Welcome back to What's Now. We are continuing our focus on our health during this episode. And adults even need immunizations. Sometimes they're easy to forget about or skip. Maybe we get busy, or because of the pandemic, may not want to go to our doctor's office. Well, I recently spoke with Dr. LaTasha Perkins about why we need to make sure we are up to date on our shots.
While the effects of the pandemic continue to impact our communities, recent data shows that there's also been a steep decline in non-COVID-19 immunizations among older adults. Healthcare experts are concerned that not getting these vaccinations can leave you vulnerable to preventable illnesses that claim an estimated 50,000 lives each year. Dr. LaTasha Perkins is joining us to talk about the data and importance of routine vaccinations. Thanks, Dr. Perkins, for talking with us today.
Thank you for having me.
So can you shed some light on the vaccinations recommended for older adults?
Absolutely. So it depends on your age, lifestyle, prior immunizations, as well as other medical issues. But the most common vaccines that we recommend are shingles, the pertussis or whooping cough vaccine, pneumonia, and the annual flu vaccine. These are important now because of the pandemic. We want to make sure that we don't put an added strain on our healthcare system. We also want to make sure that we avoid another vaccine or have another vaccine preventable outbreak. And so getting these vaccines is extremely important. And I'm glad we're talking about it today.
And not getting these immunizations puts older people at risk for complications when fighting infections, correct?
Yes, as we age, our immune system weakens a bit. And so in order to have a robust, response, we want to make sure we have these routine vaccines administered, because we don't do well when we have a difficult time fighting these illnesses these infections as we age. And we get more complications as adults when we get these infections, more chronic medical issues, more hospitalizations, even death. About 50,000 Americans die of preventable infections every year. And disproportionately, these groups are adults and older adults. So it's important to get this stuff every year and to talk to your doctor about it.
For anyone that's skeptical about going to the doctor's office, please explain some steps that are being taken to ensure patient safety.
I'm so glad you asked that. Family physicians in most doctors' offices are taking innovative steps to make sure that you stay safe. Things like the curbside waiting room, where you wait in your car until it's time for you to go in and you go straight to the exam room. Also, the virtual home visit is happening more often, where you talk to your doctor over the computer in the comfort of your own home. If it comes that you decided you need the routine vaccine, we also have things like the drive-up administration, where you can go get your shot, drive up, and then drive on home. Also, special hours for our more vulnerable populations, like our older patients. And so there are multiple things that we're doing as a global unit, but also feel free to contact your family physician and ask them, what is your office doing to ensure that I'm safe? That way, all of your questions or concerns are addressed and you can go in with peace, or you can stay home and have a virtual visit in peace.
Are there any questions older adults need to ask physicians about vaccines and healthy aging?
Most people want more information. Most older adults want more info. So whatever info you need to help you feel safe, rest assured that every vaccine that we're giving is safe, but you may have an individual question based on your own medical history that you have a concern around safety. Please get that question answered so you can get your vaccine. You need to know when certain vaccines are available, when you should get them, where you should get them. Find out when and where. That way you feel informed and you feel confident that you're getting the right vaccine during the right time. We just want people to be more familiar with what routine vaccines they should be getting. Pediatrics isn't the only time you should get vaccines. Adulthood is too. And 95% of primary care physicians agree with me when I say the healthiest way to age is to be vaccinated against preventable issues.
And where can we get more information?
You can get more information at thefamilydoctor.org. Again, that's familydoctor.org/adult vaccinations. Again, that's familydoctor.org/adult vaccinations. Listen, we know that getting a vaccine is a selfless act. You're making a sacrifice, but remember, you're making a sacrifice for your loved ones. We're going to get a community immunity if everyone signs up and we do this together. We've done it before. We've eradicated illnesses and infections in our country. We can do it again. Let's do it together.
Thank you so much, Dr. LaTasha Perkins, for joining us today to reminding us about adult vaccinations and making sure that we keep our health care as a priority.
Absolutely. It's been a pleasure. Thank you for having me.